All right. Well, thank you so much, Marianne, for coming on this call here with me today. I'm really looking forward to our conversation today. Really just kind of delving into making lifestyle as a form of medicine. I feel like I'm very passionate about that. I know you are too. So I'm really glad we had a chance to connect on this call today. And for the people that are going to be watching this video, for me to introduce Marianne Martin. She's a retired endocrinologist. She studied at UCLA. She's a dedicated mom and wife now, and she is a health coach based out of Las Vegas, Nevada, and she's worked with clients all over the country. And so I'm really glad to have a chance to actually discuss some of the important aspects, I think, that it comes to taking care of a person's overall health. And before I kind of ask you some of your knowledge and your background about how you could best serve your clients and how you've done that, I would like to preface our conversation with 2 articles that I found here on the internet. And it's great that we have the access to this information because it can allow us to make really good health decisions for ourselves. But the first one is actually an article I found out of Johns Hopkins. And they did a research study here over the past 8 years. They had a team that actually went into hospital settings and researched cause of deaths situations for people that have passed and what was really the breakdown of the cause. And so first being cardiovascular events, heart disease, the second one being cancer, and unfortunately the third cause that they found in this study was due to medical error, or iatrogenic disease as they call it. So it really was, they found 250,000 deaths for last year due to medical error alone in the United States. And then following that was respiratory disease. So this is not a small issue when it comes to the kind of side effects and some of the things that can happen when having to try to address some of the critical health issues that a person might have. The second article that I thought was actually very telling for us as a country comes from a recent article from the American Bankruptcy Institute. And unfortunately, 56 million, I'm going to make sure I read this number right, people struggle with medical debt every year. And unfortunately, 62% of those people have to file for bankruptcy. So they found actually in a recent run of their statistics that 62% of people that file for bankruptcy overall is due to medical debt. And unfortunately, a very large percentage of these people refinance their homes to be able to get a second mortgage out, to be able to pay for medical debt. And a lot of times that's not a really good play, but that's some of the things that people try desperately to do in order to pay hospital bills. So that being said, we know that there is a critical point when it comes to our country's health, because unfortunately, even though we spend the most in revenue towards our healthcare system, we still rank, depending on where statistically you find this information, below 15 other countries. In some rankings, it's under 30 or even 48 other countries ahead of us when it comes to having a healthy population. So as a health coach and with so many years of experience in the healthcare field, I really just wanted to get your take on, first off, a really big thing that I know many people have heard about is diet. So when it comes to diet, I guess kind of exploring a little about like what types of food can help manage some of these disease issues, specifically chronic health issues, because a lot of our population is dealing with diabetes. That's a huge one. High blood pressure, polycystic ovarian syndrome. A lot of these issues have been created over a long period of time. So as a health coach, how do you find that, diet in itself, how that it plays a really important part in being able to mitigate some of these diseases?
Well, so I know that you have put in a lot of effort and time in really investing that knowledge and work in finding this out for yourself, because I know as healthcare providers, none of us were taught this in our training.
It's unfortunate. You're right.
It is very unfortunate. And so I almost feel like the first thing that we have to do as a nation is to make sure that that is part of the education, because patients are coming to their healthcare providers for that specific knowledge and information. And there are many people who either don't have that knowledge or are feeling the pressure of seeing so many patients in a short period of time. Even if they had the knowledge, they don't have the time. And
Right.
so I agree with you. Our country is incredible with the amount of technology and everything that we have been able to come up with, but some of our priorities are maybe not in the right place as well. And
Right.
so when you're able to really take a look at diet, I like to keep it very simple. I think the more complicated that you make it, the harder it is for people to follow. And so for me, it's all about the more fresh foods that you can get your hands on, the better that's going to be. Now, I'm not going to say that you have to have your own garden and everything has to be organic. I mean, that would be in a perfect world.
Right.
And there are some financial limitations that people are going to have. But even at a fast food restaurant, you can learn how to order a better meal than
Right.
maybe what you've been ordering. And so it just starts with number one, being able to say goodbye to negative influences in your life and old habits that you might have grown up with. And to really step into that space to say, if I don't want to get the diseases that my parents and my grandparents had, and all the pills that they were on as they aged, if I keep doing what I'm doing, which is what they did, I'm going to end up right there.
Right.
And so, you know, there is so much that we can do economically to shop for things that are still going to be good for us, and it doesn't have to cost like over $100 going to Whole Foods.
Right.
So, you know, it's really just let's start with some vegetables that you like, and let's then start with some lean proteins that aren't fried. And
Yeah.
let's start with, you know, if you're going to have carbs, look for some fiber that's going to be in it so that you can get some whole grains. I think if people just start with that, just simple switches. Like one of my favorite people were the people that came up with eat this, not that, because it's
Yeah.
just so simple, right? To make a switch. So yes, if you just switch from white bread to wheat bread, that's
Right.
already going to be better. You know, brown rice instead of white rice. So just simple substitutions like that in the beginning. And
Right.
then you can sort of graduate to just better and better whole foods. But it starts with one change at a time. I know some people, they want to like try to do everything all at once. They want to hydrate, they want to improve their diet, they want to exercise, and then it's too much. And there are a lot of people who say, if I can't do it 100%, I'm not going to do it at all.
Right.
So we have to help them step back and just see, okay, this week, let's work on this. Awesome. Now you're great at that. Let's move to the next level. Let's move to the next thing. So I really think one of the wonderful things about being able to work with somebody one-on-one who has the knowledge and who really cares is that it can be customized for food intolerances, food allergies, what's accessible, you know, what is convenient. Some people like to cook and some people don't. So it's just getting to know somebody really well and seeing how we can improve little habits in their life.
Right. Right. Just start small and then commit to that change. And then
Exactly.
how quickly that can shift down to a whole different trajectory for you. I love that.
It's like
Um,
compound interest, right? You just build and build and build.
yes. And that's what keeps it sustainable. I think the draw sometimes of a diet fad is the pounds might shed off a certain point because there's something happening, but to be able to sustain that for a long term might be very hard to do, depending on the diet, if it's really for you.
Absolutely.
So yes, thank you so much for that. So, um, in your perspective, how does regular physical exercise, how does that help mitigate chronic illness? Because I know for a lot of people that I've worked with personally, they're, obviously they're making a difference at work. They're working long hours. They're sitting a lot of times in front of the computer for extended periods of time. So the inactivity is the portion that is sometimes a hard shift to make. But from your experience, how important is it to be able to get that physical activity in at whatever level they can? And like, what's your input on that?
I love this because, again, it's almost like looking at nutrition as well. So, number one, it has to be easy, and hopefully it's also fun, because
Yeah.
what I enjoy doing may not be what you love doing. So, it's really just figuring out what pockets in your day or evening can you fit in 5 minutes or 10 minutes in the beginning. And so many studies have shown that so they actually did a study on the most productive, successful people. And the longest they would ever work in a row was exactly 53 minutes. That's it. After 53 minutes, they would take a 5-minute break. That 5-minute break could be doing jumping jacks, push-ups. It could be squats. It could be any activity that just gets their heart rate going a little bit, allows their eyes to relax if they're on a computer. So you're taking that hard break to reset. And as soon as you come back from that 5-minute break, you're more productive. You're thinking more clearly. Your brain is more creative. So you're not just doing it for your physical health, but you're doing it for your mental health as well.
Right.
But it's also that when you feel better, when your body feels better, you actually crave healthier foods. And when your body's tired and achy and sore, that's when we want the comfort foods.
For sure.
So it all works together. But again, just like when you're working on your healthy habits with exercise, if you're not a person who already has that built into their schedule and is consistent with it, make it so ridiculously simple, the first goal, that there's no way that you can't do it. So
Mm-mm.
it doesn't matter if you've got 6 kids, you work and you come home at 9 p.m., your first goal may be, I'm going to do 5 minutes, either before I wake up and start my day and get the kids up, or I'm going to do it, when I get home or whatever. But everybody has 5 minutes every single
Yes.
day. You
Hmm.
can't do it. And sometimes you set an alarm to make sure that you don't miss that, so you're creating habits. And once you get 5 minutes in consistently for a week, you're going to feel great. You're going to want to increase that. And so it just starts with something very small and ridiculously easy for you to accomplish, so that you have that sense of accomplishment. Because the worst thing that we can do is say, all right, I haven't exercised. I'm going to the gym for 2 hours. That's when you're going to injure yourself,
Very true.
right? So it's taking those baby steps, building your confidence, building your skills, and working up from there.
Yep. Yep. Almost it mirrors, right, the food and how we incorporate the changes in order to reflect obviously more positive health outcomes for ourselves. But you're right, 5 minutes, everybody has 5 minutes.
Well,
um
and that's the power right there. When you combine good nutrition and something daily that you're doing to have healthy motion, not necessarily going to the gym and lifting weights, but just any healthy motion, when you combine those two, the majority of the people that I saw in the office when I was practicing were diabetics,
mhm.
PCOS, thyroid, blood pressure, cholesterol, menopause. All of these chronic things are going to be improved with nutrition and exercise.
Yep.
Every
100.
one of them.
Yeah. 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 And I mean, at the start of when we were talking, you know, I'm still amazed sometimes going through the level of education that I know that you have and that I have, becoming a physician assistant, of all the, I guess, blind spots that I guess was not necessarily in the curriculum, that I think the majority of the public assumes that your healthcare provider should know what's best for me. But the reality is we know what we've been taught in school, and we know how to provide a certain protocol so that if ever there is a situation where, you know, other providers were to look at our work, they'd say, okay, that's deemed appropriate by the the American Medical Association, right? So there's that to consider. But you're right. When it really comes down to the amount of time that you have in the office with the patient, and to be able to explain and sit with them how some simple changes, and encouraging a person to do that and commit to that, would make such a difference, really, truly make such a difference. So I appreciate you saying that. Yeah.
Well, and I can't ignore this as well. You know that healthcare providers, we're usually the ones who don't take care of ourselves, right? Because we're so busy taking care of everyone else, our self-care gets kind of pushed aside. So
Yeah.
if we're not getting enough sleep, if we're not making sure that we're not overly stressed, this is, you know, a possible contribution of the medical errors. People not getting enough sleep, people really overwhelmed with stress and too much work and all of that. So it all ties in that we have to be good examples and role models first as well.
Right. Amazing. Very true. Yes. Oh, this is great. Oh, I feel like this is great too. Okay. So looking at stress, that's what we'll say. So how do you believe that stress management or any type of stress management techniques might be beneficial to incorporate in, let's say, a healthy lifestyle change, for a person? And why is that important? Because I've heard the story before from clients, you know, who doesn't have stress. Stress is just what it is. You know, life is stress. So some people have embraced stress in that way, but it really, I feel like, wreaks havoc when it comes to, you know, are you going to be able to get over this high blood pressure issue? These other things. So as far as how you would believe that like stress management techniques influences your health.
Oh, it's such a big role. And I'm a big believer in this. Because we're all human, we're all going to experience stress in our lives. None of our lives are going to be picture perfect. The important thing is, how are we responding to that stress? Because that's what influences whether it affects your health in a good way or in a bad way. So, for example, when I'm working with clients, I'm really helping them shift how they used to respond to, let's say, for example, they get yelled at by the boss unfairly.
Mm,
And in the past, their go-to would be to grab a bag of chips as their comfort to handle that stress, or to go out on a break and smoke a cigarette,
right.
or later on that evening, go to the bar and drink excessively, whatever it is. Okay. So just helping them have a different response to that stress is going to make all the difference in the world in how it is going to affect their future health.
Right.
So I love working on the mental mindset with clients. It's such a huge part of their health journey.
Yeah, for sure. Um, I kind of deviated after leaving family medicine and went a very scenic route into yoga and meditation and mindfulness. And so, not to brag, but in times of what other people perceive as very stressful, to be able to bring a presence to just being present is an incredibly, I'd say almost a superpower, especially depending on what type of stress you're dealing with. So that's, I think, one thing that I kind of open up some of my clients who haven't delved into that realm of mindfulness, is one tool that I find is incredibly beneficial to be able to help mitigate, people that have very sensitive cardiovascular systems, might be dealing with blood pressure issues, have a tendency to have a negative, downward spiral when something triggers an initial, response within them. And sometimes it's very hard to tailspin out of that. So
Mhm.
I'd say one of the things that I almost make as a homework assignment for most of my clients, pretty much all of them, is to be able to start your day before you even sometimes put your 2 feet on the ground from getting up in bed, to be able to get yourself in that space. Before you check your emails, before you have to check on the kids, that 5 minutes that you mentioned before of some type of positive movement is positive mindset, even before you start your day, because that will take you leaps and bounds than trying to be able to play catch up the rest of the day because you're ruminating over something. Um,
Mhm.
so I think that's incredibly important. And to your point, that it's very much a necessity when it comes to helping with chronic illness. So yeah.
I agree with you. Having a mindful morning routine is absolutely crucial. And for me, part of that is not checking my phone until I'm ready to check my phone.
That's great. That's great. That
Yeah,
might be a habit for some people to break, because it's such an addiction, honestly. Um, I don't know about yourself, but recently putting myself into learning about sales and marketing, because I think that's an important tool to have. The way that this device is crafted is is to the point where they recognize, these companies like TikTok, Facebook, they know exactly what neurologic buttons to push on you to be able to get you to engage in screen time.
right.
So the data that they've accumulated from so many users, that this has become a very addictive device for majority of us. So it's not that, any one of us is perfect, but yeah, to be able to spend maybe less time on the screen is possibly a goal that some people can aspire to too. So Marianne, when it comes to sleep, it definitely seems like an issue for a lot of people to be able to, number one, fall asleep and then stay asleep throughout the night and then feel rested after they get up for the morning. So I just kind of wanted to pick your brain about what you find as far as being able to, maybe effective tools, or the reason why it's important to spend the time to get yourself to be able to have a healthy sleep pattern. If you could speak to that a little bit.
Oh, sleep is the foundation of living a healthy life. Partly because if we don't get enough sleep, we do have two hormones that are going to be out of balance the next day. So when we don't get enough sleep, we have a very nasty hormone called ghrelin, and
Mm.
it makes you crave bad things and you're never satisfied.
Oh,
So your body actually makes more ghrelin and it makes less leptin, which is the good hormone that allows you to feel satisfied when you eat a right healthy portion. So when we get plenty of sleep, we have more leptin and less of the bad ghrelin. And you're right, it may take a little intentional work. There's a lot of people who like to stay up and watch TV
mhm.
or scroll their phones instead of actually getting into a bedtime routine an hour or two earlier than they are right now. So there's not like a hard fast rule about what time bedtime should be, but for many people, going to bed by 11 p.m. allows those hormone balances to be at their best.
Okay.
And, there are going to be people because of work schedule or their students or, whatever, it may be later than 11 p.m. But if people can try to get as close to an 11 p.m. bedtime, and the ideal number of hours for most people, again, somewhere between 7 to 9 hours. I
Yeah.
don't know what your sweet spot is, but my sweet spot is right around 6.5 to 7. If I
Mhm.
sleep way more than that, I actually get more tired.
Yeah. Yeah.
So But as far as what you can do specifically to improve your sleep, I think it's all the things that we've actually talked about. If you're eating high fat foods late at night, you are going to probably have indigestion, acid reflux, other things that are going to wake you up or keep you up.
Right.
And especially alcohol, it does allow you to fall asleep, but you're not going to stay asleep. You're going to
Yeah.
wake up in the middle of the night. So there are foods and beverages that are probably not going to help you in getting a good night's sleep. So again, it just goes back to having a good foundation of as healthy, nutritious, whole grain foods as you can, and not eating super late at night. Allow your GI system to break down some of the food before you actually go to bed.
Right.
But then it's also what you were really focusing on too, is maybe practicing some mindfulness, whether it's a little meditation at night, or if it's a person of faith, maybe just a little prayer time, but something where you're detached from electronic devices,
Hmm.
allowed to just be in a relaxing space, not a lot of blue light, and just a calm environment. I mean, the reason why we're so relaxed when we're on vacation is because most people choose to go to like a tropical area, and it's
Yeah.
beautiful and it's relaxing and we have no care in the world. Well, why can't we create that when we go to bed?
Right. Yeah. Very true. There's so much to that. There's, most people at being in a tropical environment get some sunlight. That's another thing that you can do for yourself. And that does so many beneficial things for your hormones to be able to create certain things. They do that. There's not so much of an expectation. They're trying to be more, they don't even have to try because you're on vacation. So you're hopefully more present with your loved ones, that you're out and able to enjoy that time. So you rest well.
Mhm.
So trying to kind of create an oasis before falling asleep at night is a great idea to kind of
Yeah.
promote that. How important, I guess, health coaching is now, especially, and how that complements medicine. Because I feel like I've even heard of physicians being told by their hospital groups that they're being paid, incentivized to take a accredited health coaching course to be able to help with patient outcomes now. So the
Mm.
hospital groups are recognizing the effectiveness of health coaching. So
Thank goodness.
yeah, it might be slow, but it's gaining some traction there. And yeah, so how you might find that this type of work is very helpful for someone, along with seeing their provider. We're not necessarily discrediting, obviously the people that we find as our fellow colleagues in healthcare, but how health coaching is probably helpful towards getting the health outcome that you're looking for.
So this is so close to my heart because in the last 3 years when I was practicing as an endocrinologist is when I started health coaching as well. So I was doing both at the same time. And what I learned as a health coach myself was how to improve my mental state and how to really learn how to partner with somebody instead of that top-down model
Right.
where somebody comes to you and they're really just asking you for all the answers and you tell them what to do, but you haven't really had a conversation. Is this really what you are willing to do? Does
Right.
this make sense to you? And are you willing to do it? So I think traditionally, when we saw patients in the office, that was our role. Like, you come to me you tell me what your problem is. I'm going to assume that the solution I give you is going to work because if you follow it 100%, it will.
Yeah.
Um, that's a big if.
Yeah.
Um, and so then when they come back and it doesn't work, what do? We don't dig further into the problem. We just give them a different solution.
Right. Right.
So what I learned as a health coach is I don't want that top-down relationship. I actually want to partner with whoever it is that I'm working with, get to know them on a very deep level. what's going on in their home life? Who is supporting that change for them to become the better version of themselves, and who might be standing in the way and
Mhm.
making it difficult for them to make that change? How can I help them through that? What are their, financial constraints? What can they do? What are they, motivated to do? If somebody wants to get healthier, it all has to do with their why. Because you and I both know, if somebody came in and was told they have a life-threatening cancer, this is the medication that they have to take. It tastes awful, it's expensive, and they're expected to do this every single day for the next 3 months. You better believe they're gonna do it, because their
Mhm.
motivation is sky high.
Right.
But chronic diseases sneak up on us.
Mhm.
They build every single day. And the day that we were supposed to start focusing on our health was 5 years ago.
Right. Yeah.
And so when you don't feel bad right now, your motivation is not going to be that high to make a change unless we're able to point out how it's going to help you show up better as a partner, as a parent, as, a friend, as a coworker. So when we start getting to know people on that intimate level and really point out, if you make these little changes slowly every single day, do you know how much more engaged you're going to be able to be with your kids? Do you know how much more confident you're going to be this summer in a tank top and shorts and not have to hide when everybody else is at the pool? I mean, just the physical and the mental aspect of being healthier is it really is different for each person, but we as health coaches, that's what we have to bring out in that person. We have to do that digging and find out what is their powerful why that's going to help them do the work.
Yeah. Yes. And it's such satisfying work. So yeah, for sure. And well, I mean, that's pretty much all the questions I really wanted to broach with you when it came to health coaching. And obviously, I could tell it's such a passion for you too. And so I thank you so much for your time and being able to share, some of your wisdom with me today. Thank you again.
It
And
was my pleasure.
yeah, so yeah, that's that's how I will end it, I guess. And